Hello everyone, I am Shweta doing first MSc Microbiology. We are going to discuss about Streptococcus mutans. General characteristics of Streptococcus mutans. It is a gram-positive bacteria and it is spherical in shape. Its arrangement chain form arrangement usually in pairs and it is non-motile in nature. Size 0.5 to 0.75 in diameter and it is a Streptococcaceae family. Capsule present and its endospore is absent. Streptococcus type, it is one of the 8 species differentiated based on their heterogeneity in their genomic structure, respiration, aerobic or facultative anaerobic, optimum temperature at 37 degrees Celsius, optimum pH at 6, habitat usually the human mouth, more specifically dental plaque. It is discovered by James Killian Clark in 1924. Pathogenesis of Streptococcus mutans, disease transmission. Streptococcus mutant infection are mainly transmitted by person to person, spread by respiratory droplets through vertical transmission from mother to child. Virulence factors of Streptococcus mutans: acid production, extracellular polysaccharide synthesis, biofilm formation, carbohydrate metabolism. Incubation period 1 to 3 days, infective dose variable. Pathogenicity of Streptococcus mutans. Streptococcus mutans are karyogenic organisms residing in the human mouth and occasionally causing dental caries. Because it is a common cell, it has a different mechanism that allows it to adhere and to colonize the mucosal membrane of the oral cavity. Streptococcus mutans are other karyogenic streptococci such as Streptococcus sanguinis could be potentially the causative agent of an oral infection if present in the salivary substance from an infected individual mixed with food or drinks. Clinical disease caused by Streptococcus mutans, dental caries and infective endocarditis. Dental caries is the primary infection or diseases associated with Streptococcus mutans resulting in cavities and gingivitis. In some cases of infective endocarditis have also been associated with this species. The first one is dental caries. The signs and symptoms associated with dental caries differ according to the location and to the extent of infection. However, the common signs and include spontaneous toothache that occurs without any apparent cause. It also increases the sensitivity with visible holes in the teeth. Brown, black, yellow or white staining is seen on the surface of the teeth. If not treated, the biofilms slowly move into the deeper tissues and cause gingivitis. Septicemia is also possible if the infection is persistent. The second one is infective endocarditis. About 20% of endocarditis cases attributed to virulent streptococci are caused due to Streptococcus mutans. The organism moves through the blood and can bind to a pre-existing injury to the endothelium that might expose extracellular matrix components such as fibrinolactin, laminin, and collagen. Patients with endocarditis experience flu-like symptoms including chills and fever, chest pain, and changed heart rate are also typical. Laboratory diagnosis of Streptococcus mutans, microscopic examination. In gram staining, it is visible in violet colored gram-positive cocci arranged in form of chain and it is non-motile in nature. Colony morphology on culture medium. Nutrient agar, white to grey colored colonies. Growth is mostly poor and requires air with supplied carbon dioxide. In blood agar, whitish grey, circular or irregular, alpha or gamma hemolysis. In special selective medium, Mitis salivaris agar, raised convex pale blue colonies can appear, granulated Foster glass appearance. In sucrose agar, smooth heaped colonies, mucoid beads, puddles of liquid on surrounding the colonies. In biochemical tests, catalase test negative, oxidase test negative, urease test negative, indole test negative, methyl red test negative, Voges Pasquier test positive, citrate utilization test negative, starch hydrolysis test negative. Casein hydrolysis test negative, glucose fermentation test positive, alkaline phosphatase activity negative, arginine dehydrolase negative, epurate hydrolysis test negative, bacitracin test resistant, PYR test negative. Treatment and prevention. Chlorhexidine is considered the gold standard for oral antimicrobial therapy. It is not recommended for long term daily therapeutic use. Oral infections are treated by using afloxacin, doxycycline, tetracycline, chlortetraxylin, erythromycin, vancomycin. Some infections like endocarditis and bloodstream infection might require removal of the medical implants and immediate treatments. Maintaining proper dental and oral hygiene. The application of 1% chlorhexidine collagen gel daily mouth rinsing with 0.05% sodium fluoride solution has been found to decrease the chance of dental caries significantly. To avoid severe cases of infective endocarditis, it is recommended to treat dental caries as soon as possible to avoid the spread of bacteria into the bloodstream. No vaccine is currently available. Thank you for your patience.